Welcome to Chapter 12 of Ethics and Professionalism. Today we're talking about conflict resolution. So, a conflict is a condition that occurs when two or more people have different attitudes or ideas about how something should be done, or it can be when one person has to choose between two inconsistent actions. And then resolution is simply a solution found or formulated to end the conflict. Conflicts and differences of opinion are inevitable when working with or providing services to others. The expectations of others involved are not always the same, therefore conflict tends to occur. However, it's very important when a conflict does occur to reach a resolution as soon as possible with those involved. So why conflicts happen? Conflicts happen basically due to unclear expectations of the situation of the parties involved. They occur from crossing boundaries, a therapist crossing boundaries, or an employer crossing boundaries, or even when a client crosses boundaries. And poor communication is our third reason why conflicts occur. So briefly talk about the unclear expectations. Many times a conflict arises when one or both parties have unclear expectations regarding the other party. Our text gives the example: in a practice with several therapists, one therapist may expect the other therapist to always be neat and clean up after themselves after each day's work. And although this may sound like common sense, some therapists may prefer instead to clean up before they start their shift in the morning. So unclear expectations can arise when a person's own guidelines and habits are not the same as those of others around them. Expectations also frequently change, and it can be frustrating to have conflicts develop even when a policy has been in place for a considerable period of time. Unclear expectations can often be avoided by careful planning and communication. Clients who have unclear expectations about their therapy tend to also cause conflict within the workplace. Always be sure and be clear with your client at each session what their expectations for that particular session is. Clients also have expectations for their therapy session itself. Again, make sure you know what the client is expecting. A client may expect the therapist to make them 100% better in just one session, where experienced therapists know that to educate their clients about the long-term process of working on a chronic or established condition. Years of problems and pain cannot magically disappear in a 1-hour session. Conditions such as arthritis, injuries, and long-term overuse are frequent maladies that clients suffer, and of course everybody tends to want the instant gratification. They want to be better instantly. So it's our job as therapists to explain to our clients that most of the time these conditions didn't happen overnight or instantly, and most of the time they're not going to go away with one session. And if you explain it to your clients in a realistic manner, they tend to realize that, and then they're not upset. So make sure you have very clear expectations, and make sure you inform your clients if their expectations are not obtainable in one session, or whatever their expected date or guideline of number of sessions tends to be. Okay, we'll move on. Key points from unclear expectations. Unclear expectations can often cause conflict. Planning and communication can help avoid this conflict. And expectations should be stated or expressed by all parties involved. Next up, we have crossing boundaries. The therapist should be knowledgeable of boundaries of the profession. The laws, rules, regulations, and the codes of ethics of professional associations or groups must be followed. Problems can arise when an individual either is not aware of such boundaries or chooses to not accept those boundaries. A therapist who deliberately chooses to cross legal or ethical boundaries certainly raises ethical issues. The NCBTMB has increased the required number of continuing ed hours for ethics from 2 hours to now 6 hours. And many other professional organizations also now require more hours in ethics. Move on. Key points. Therapists should know the boundaries of the profession. Conflicts and ethical dilemmas often involve boundary issues. And boundaries protect the clients and the therapist. And finally, poor communication is our third reason of why conflicts happen. Effective communication between a therapist and a client, other therapists, and an employer is important to help prevent conflicts. Expectations and boundaries can be verbalized or written to help prevent anyone from having incorrect expectations. Written communication includes statements, rules, or policies presented to a client and signed by the client before treatment is rendered. Intake forms often state that what the therapist is able or is not able to do. Verbal communication happens continuously in the therapeutic relationship. After the initial intake interview, a therapist should seek feedback often from a client, and the client's expectations cannot be met if the therapist does not have a clear picture of what those expectations are. So communication is very important in our field. Also, when a client does communicate a need, such as less pressure, therapists should listen and follow what the client is telling them. Anytime a client communicates their needs, it's important for the therapist to listen carefully. If the client is not communicating, it's important for the therapist to ask for feedback, ask for communication about the client's needs and goals for the session. Good communication involves constantly checking in with clients, with fellow therapists, and with employers to help prevent conflicts from developing. Key points. Communication between the client and therapist can help prevent conflicts. The therapist should focus on both verbal and nonverbal communication from your client. And if a client does not communicate, the therapist should ask for feedback. So again, with our clients asking us for advice on their medications, it's out of our scope of practice. So I always tell them that they need to ask their doctor about that, their prescribing doctor. Be careful not to get out of our scope of balance, but at the same time you want to keep communication going between our client and us, as well as between our client and their prescribing doctor. So feedback communication is very important throughout the session. If they're not offering feedback, you should be asking for feedback. Next session deals with the types of conflicts. Conflicts can occur with several different parties. We have conflicts with our clients. These usually result from unclear expectations by one or both parties. We also have conflicts with other therapists. When we are working in a practice involving more than one person, there's typically many differing perspectives and ethical standards. So group practices also have the potential for a variety of conflicts because of different beliefs and policies and procedures, as well as different skills, techniques, advertising, different forms of dressing, different fees, and general office equipment. So conflicts in a group setting can also include conflicts between the therapists, and whenever those conflicts occur, it's best to try to resolve those as quickly as possible. Next, we have conflict with an employer. So when one works as an employee, the ethical standard of the employer are generally the accepted standard of all employees that are expected to follow. Problems are more common in the workplaces when the employer does not have set standards for the standard, or those standards are set too tight or too loose. Whenever you work for another person, it's important to understand that person's expectations, and typically you want those expectations to be in writing so it kind of clears up any boundaries. And finally, we have conflicts with other healthcare professionals. So as more and more healthcare professionals begin seeking massage therapy services for their clients, more conflicts do tend to arise. So the need for massage grows. The healthcare providers use massage therapists and body workers to help address many of their clients' health issues. Some use body work as an adjunct therapy to enhance the effects of what they are doing with their clients, while others refer a client or patient specifically for massage for a particular condition. Many therapists also actively seek out referrals from other healthcare providers. So when a massage therapist develops a relationship with other healthcare providers, it's important for both parties to know the expectations. And conflicts can and will happen between clients and therapists, between two therapists, between therapist, employee, and employer, and with other healthcare providers. So again, the main thing is to resolve the conflicts as quickly as possible. Key points: it's important to know both parties' expectations. Expectations can frequently change. Know that group dynamics play an important role in conflict and resolution. Policies and procedures can help prevent conflicts from occurring in the first place. And conflicts between a therapist and a client can be prevented with good communication. Again, always ask your client at the beginning of each session what their expectations or goals are for today's session. So the steps for conflict resolution. First, you want to identify who's involved with the conflict. Then you want to identify the problem, what the actual conflict is. Research the facts. Consider possible solutions and outcomes, and discuss the solutions with the parties involved, and then compromise and resolve the issue. Key terms: conflict, as we said, is a condition that occurs when two or more people have different attitudes or ideas about how something should be done, or it occurs when an individual person has to choose between two things that are contradictory. And a resolution is simply a solution found or formulated to end a conflict.